Recognizes Eloise Sutherland, testifying on behalf of yourself, and you are against House Bill 1586. Is that correct?
That's correct.
Thank you. You may proceed.
Well, good evening, and thank you all for allowing me to testify today. I am here in opposition to HB 1586. Granting relaxed opt-out choices to parents will prevent establishing herd immunity to many infectious diseases, resulting in more child deaths and more children with disabilities. Back in the late 60s, when the rubella vaccine was newly released, but herd immunity had not been reached, I became pregnant and was infected with rubella. My son was born deaf. He's grown now and is able to support himself, but reaching that level of self-sufficiency, however, has taken years of special education, and it was provided by the state, as well as expensive hearing aids that must be replaced every few years.
As a parent, they're my kids, my husband's kids. That's our legal duty and our right to protect them. It's not the school's job, it's my job,
Yes.
right?
We're partners though, right? We
Well-
partner together. If you're in public school, right?
Your children are none of my business. Do you have
I'm
anything
sorry to
else?
hear that. Sorry to
I
hear
mean,
that.
my job
Y'all are my representatives. You represent me.
Gary Gates does, yes.
Well, yes, but I would hope you do too.
I want you to get it. I think what these women are saying is that they want to ensure that healthy kids that have the ability to be vaccinated, that can reduce the risk of infection spreading to your daughter, is their stated goal.
I'm not asking for that.
It's what we as a herd are willing to do for society, but if we're all not in on the game of being willing to be together and not individual, the game ends because the diseases win. They will win.
The CDC's own website shows 38,000 deaths attributed to the modified RNA in the COVID shots at the Vaccine Adverse Event Reporting System, and 1.6 million injured attributed to the modified RNA shots. To put that in perspective, 43 deaths were attributed to the swine flu vaccine in the 70s, and it was withdrawn because that was too many people injured. The Florida Surgeon General has, at the Florida Department of Health website, he says that he can't recommend these mRNA technologies for any people in Florida. He's the #1 doctor in Florida, and he says that there's evidence that it's adulterated with SV40, which is a oncoprotein, a cancer protein from green monkeys, and also with DNA plasmids, which are used in the mass production of the mRNA, and is supposed to be removed before it's on the market.
Developed with my colleagues at UT Austin that is now stockpiled around the world as a countermeasure against bioterrorism. I am here because I'm against SB 1887. Much of what we just heard has been discredited by scientific, rigorous study. This body deserves a rigorous discussion that's balanced. That is not what you have just heard. I am concerned that if this bill is passed, it's going to be the case that Texas is no longer a place where biomedical science is appreciated or valued. The economic impact of that, as we just heard, would be devastating for a biotech industry that is just taking hold and taking off in Texas. Beyond the negative economic consequences, passage of this bill and the resulting publicity would also likely make it impossible for us to attract top doctors, faculty, and students to our best universities and medical centers.
What difference does it make whether it's there or not? Either the vaccine works or it doesn't work. And why is a child who chooses not to be vaccinated any more of a threat than the child who cannot be vaccinated for medical reasons? That you accept their reason, medical, why is this child more of a threat than that one?
A couple questions, Reka, if I could ask you. How does this bill have the potential to impact the rights of kids who have a medical need to be exempted?
Well, I mean, obviously, children who have, are medically contraindicated, they're at greater risk because, again, as Becca had mentioned, when there is a correlation between exemptions and outbreaks. The more people who are exempted out of vaccines, then the higher the risk of the outbreaks. And the concept of herd immunity, where we need to have a certain percentage of the community vaccinated or protected against these diseases, helps kind of act as a shield. And so for those children who cannot be vaccinated, we kind of have a responsibility as a community to make sure that we achieve those high vaccination rates in order to protect those people, those young children, those older individuals, people like my mom who has who's immune compromised, who's on biologicals, who's medically fragile herself, to make sure that there's enough protection in our communities so that they don't fall sick.